Hey everyone, and welcome back to the channel. Today we're tackling a topic that's super important but often shrouded in mystery diagnostic tests. We're going to break down the most common diagnostic tests, what they involve, and what the results actually mean. Whether you're a curious mind or navigating your own health journey, understanding these tests can help you feel more in control and have more informed conversations with your doctor. So, let's demystify the world of medical tests together, one test at a time. Alright guys, let's start with the OG of diagnostic tests, the blood test. It's like getting a sneak peek into what's happening inside your body by analyzing a small sample of your blood. One of the most common blood tests you'll encounter is the CBC, or complete blood count. This measures your red blood cells, white blood cells, platelets, and hemoglobin levels. Then we have the lipid panel, which measures your cholesterol levels, those good and bad fats we hear so much about. And let's not forget about the blood glucose test, a must-have for diagnosing and monitoring diabetes. Blood tests are relatively quick, usually painless, and provide a ton of information about your overall health. So, next time you get your blood drawn, remember, you're basically getting a personalized health report card. Let's move on to imaging tests. These are the tests that allow us to literally see inside your body without having to perform surgery. The most common imaging tests you'll come across are X-rays, Connecticut scans, and MRIs. X-rays are the go-to for diagnosing bone fractures and spotting lung infections like pneumonia. CT scans provide much more detailed images of your internal structures and are especially useful in emergency situations. MRIs use strong magnets and radio waves to create incredibly detailed images, particularly of soft tissues like your brain, muscles, and ligaments. Each of these uses different technologies to create images of your bones, organs, and tissues. X-rays use radiation to create images, so your doctor might give you a lead apron to wear during the test to minimize exposure. CT scans are like super-powered X-rays, providing much more detailed images of your internal structures. MRIs don't use radiation. Instead, they use strong magnets and radio waves to create incredibly detailed images. Could signal a kidney problem. Urine tests are generally quick, easy, and non-invasive. Now let's talk about biopsies. A biopsy is a procedure where a small sample of tissue is taken from your body and examined under a microscope. Doctors use biopsies to diagnose a wide range of conditions, from infections and inflammation to more serious concerns like cancer. The type of biopsy you have will depend on the area of concern. For example, a skin biopsy might be used to diagnose skin cancer, while a liver biopsy can help identify liver disease. Most biopsies involve some level of discomfort, but your doctor will usually numb the area with a local anesthetic before taking the sample. While it's normal to feel a bit anxious about getting a biopsy, remember that it's an important tool that allows your doctor to make an accurate diagnosis and develop the most effective treatment plan for you. It's like zooming in to get a super close-up view of what's going on at a cellular level. Next up, let's talk about HIV testing. HIV stands for Human Immunodeficiency Virus, and it's the virus that can lead to AIDS, or acquired immunodeficiency syndrome, if left untreated. HIV testing is crucial because it allows for early detection and treatment, which can significantly improve long-term health outcomes. The most common type of HIV test is the rapid HIV test, which can provide results in as little as 20 minutes. This test usually involves a simple finger prick, and it looks for antibodies to HIV in your blood. If a rapid HIV test comes back positive, it's important to follow up with a confirmatory test, like the Western blot or ELISA test. These tests are more precise and are used to confirm the initial results. HIV testing is more accessible than ever before. You can get tested at your doctor's office, local health clinics, and even some pharmacies. Knowing your status is empowering and allows you to make informed decisions about your health. Ladies, this one's for you. Let's talk about the Pap Smear, a simple yet incredibly important screening test for cervical cancer. During a Pap Smear, your doctor will gently collect a small sample of cells from your cervix using a soft brush and a small spatula-like instrument. These cells are then sent to a lab and examined under a microscope to look for any abnormalities, including precancerous changes or cervical cancer cells. The PAP smear is designed to detect these changes early on, when treatment is most effective. Most women should start getting regular Pap smears at age 21 and continue until age 65. Your doctor will recommend the appropriate screening schedule for you based on your age, health history, and previous Pap smear results. Prevention is key when it comes to cervical cancer, and the Pap Smear is one of the most effective screening tools we have. So, ladies, schedule those appointments and prioritize your health. Last but not least, let's talk about the electrocardiogram, or EKG for short. This test is all about listening to your heart, literally. An EKG measures the electrical activity of your heart, which helps doctors diagnose a variety of heart conditions, such as arrhythmias, irregular heartbeats, heart attacks, and even heart defects. During an EKG, small electrodes, sticky patches, are placed on your chest, arms, and legs. These electrodes are connected to a machine that records your heart's electrical signals. The process is painless and only takes a few minutes. By analyzing these patterns, doctors can detect any abnormalities in your heart's rhythm or structure. If you're experiencing any symptoms like chest pain, shortness of breath, or heart palpitations, your doctor might order an EKG to get a better understanding of what's going on with your heart. So there you have it, guys. A crash course on some of the most common diagnostic tests out there. From blood tests to biopsies, these tests are all tools that help us doctors get a clearer picture of your health and make the best decisions for your care. Don't be afraid to ask questions, advocate for yourself, and be an active participant in your own health journey. Until next time, stay curious, stay informed, and stay healthy.